Hello everyone, my name is Jean Nguyen and this is my informative speech. Have you ever had a broken bone? Have you ever sprained your ankle? Or perhaps have you torn your ACL? If you have injured yourself or know anyone who's experienced a heart attack or stroke, that person is more than likely to have become a physical therapy patient. I have worked as a physical therapist aide for almost 4 years and encountered numerous people thinking that physical therapy is a similar field to massage therapists and just perform massages on patients only. This is an alarming belief from the general public because physical therapy is an ever-increasing profession, and if I may add, there may also be some of our classmates who are in the healthcare field but may feel that they do not fully understand what physical therapy is about. Today, I would like to inform you the 3 reasons why physical therapy is important, which are primarily seen in the hospital, outpatient, and sports team setting. Physical therapists are important in the hospital settings because a majority of the times they are needed to work with stroke patients. The main goal in the rehabilitation of stroke patients is establishing the maximum functional capacity in activities of daily living, as well as personal and social identity, as quoted from an article called Functional Recovery of Patients with Ischemic Stroke After Physical Therapy and Rehabilitation. So with this said, physical therapists work by guiding their patients how to do certain exercises to regain independence, and along the way, physical therapists may take on another role as cheerleading to uplift the spirit and courage for their patients, to increase for better results one step at a time. Physical therapists are also important in working hospital settings because they are needed to work with fall risk patients. And these include elderly patients who recently became hospitalized due to a fall or possible new hip replacements. Now, the physical therapists are essential and may be assisting nurses in helping the patient getting out of the bed to use the bathroom, for instance. And other times, physical therapists will help the patient to work on gait control and balance so that they can put that new hip into work. The sooner the patients gain back strength, the sooner they can get discharged from the hospital. Now, oftentimes when a physical therapy patient is discharged from the hospital, they may be required to follow up with outpatient physical therapy, and that is another important setting in the physical therapy field. In addition, did you know certain injuries are more prevalent during certain seasons as well? When I was a physical therapist aide in California, we would see a greater number of torn ACL, anterior cruciate ligament, which is a ligament in the knees due to snowboarding or skiing during the winter. And I have an example here of what the torn and normal ACL looks like. So here, you see that it's torn. That's what a torn ACL is. And then on the other side, it's perfectly aligned and everything is normal, which is the normal ACL. And so according to an article written by Pantia in 2012, it is recommended for knee ligament-related injuries to be treated by physical therapists briefly before reconstructive surgery and once again post-operative procedure. The reason is because patients that have been under close supervision of a physical therapist and provided with a physical activity program that is efficient in, quote, reestablishing the functionality of the given segment, end quote. So home exercise programs can improve strengthening and stretching to increase the mobility as well. In an outpatient physical therapy setting, another common type of pain is the low back pain. Generally with this injury, physical therapists can help alleviate the pain by providing manual therapy, in addition to strengthening core muscles for better support and teaching proper sitting and standing posture, which should be always upright. And some pain and injuries can be avoided when the patients are provided with the proper tools that are given by physical therapists, and the tools such as a foam roller to stretch out tight muscles, and it would look something like this. He's rolling on the foam roller to help reduce the tightness and the cramps and the achiness, in the back. Another would be a yoga ball. Yoga ball can be very helpful and be used as a chair to alleviate the back pain as well. And lastly, physical therapists are important in sports team settings. During a live game, an athlete may have a muscle cramp, landed incorrectly and sprained an ankle. The team's physical therapist, plays an important role in running to the court and spraying down the injured patient athlete with anti-inflammatory or help out stretching out the tightness of the muscles. From there, the physical therapist also must assess if the player is still apt to continue playing the game or must sit out in order to avoid further injury. So there's an interesting point withdrawn from the Physical Rehabilitation of the Injured Athlete ebook. When a poor movement is exercised on, it can easily cause an injury, which is readily understood. Now, the ebook also claims that a professional, quote, athlete may have fundamental imperfections in movement, end quote. This leads to the reason why physical therapists are just as important off the courts. The physical therapist is available to do manual therapy on the athletes. The physical therapist is also available to perform wraps, bandages, or kinesio taping to help relieve the pain and support sore muscles and inflamed ligaments. And with that said, the taping looks like this. It can be on, the back, the knee, the elbow, different types of knee kinesio taping for better support. And so, in conclusion, physical therapy is a growing profession, yet there are a great number of people in the general public who do not know or understand the importance of the field. I hope I have done my part informing you the importance of physical therapy, and it is needed in the hospital, outpatient, as well as sports team settings. And now the million-dollar question: do you feel like you are confident and will be able to explain why physical therapy is important to those who do not understand the field well after this speech? Thank you for listening.